Brought to you by Agilus Diagnostics.
हेल्थ टेस्ट की बात आती है तो मैं भरोसा करता हूँ इंडिया's largest diagnostics company, Agilus Diagnostics. खुद को टेस्ट करते रहो.
Hello everyone, welcome to Fit Tak. Here are the top health stories from around the world. The Indian Medical Association has decided to stop treating patients in Haryana under the Ayushman Bharat health insurance scheme. This decision was taken by over 600 private hospitals in the state due to the government's failure to pay up to Rs 400 crore they owe for services provided under the scheme. This has caused a major disruption for people who rely on this health cover for treatment. The IMA made the announcement on February 3 saying that they would no longer treat patients under the scheme until the government clears the pending dues. A meeting was scheduled on Monday to discuss a solution, but unfortunately no agreement was reached. Ayushman Bharat is an important health insurance scheme launched by the Indian government. It provides families with up to Rs 5 lakh each year for medical treatments, covering secondary and tertiary care hospitalization. This is especially helpful for people from lower income families with over 55 crore beneficiaries across the country, representing the poorest 40% of the population. However, the non-payment of dues have left many hospitals in a difficult situation, which has now resulted in this strike. In another incident in Telangana, food safety officers were shocked by the condition of a leading dairy shop called Shakti Dairy located in Jangaon district. When they conducted an inspection, they found the ghee stored at the shop was infested with flies and mosquitoes, which is clearly unsafe for consumers. They also discovered dead lizards near the food products and saw that the shop had cobwebs on the ceiling. The storage area wasn't in good condition either, with leaking roofs and damaged floors in the cold storage. Shakti Dairy is one of the biggest suppliers of dairy products in Telangana, selling thousands of liters of milk and yogurt every day. The Food Safety Department has promised strict action against the dairy under the Food Safety and Standards Act. In a more positive story, a 67-year-old man in Indore received a life-saving liver transplant after a donor's liver was brought to the city from Goa. The donor, a man named Ajay Giri, had been admitted to a hospital in Goa after suffering a brain hemorrhage. Unfortunately, his condition didn't improve and he was declared brain dead. His family, despite their grief, decided to donate his organs, and surgeons in Goa successfully retrieved the liver. It was then flown to Indore on a regular flight. The transplant was done successfully in Indore and 67-year-old man's life was saved thanks to the timely and generous act of organ donation. In a move to make healthcare more affordable, Finance Minister Nirmala Sitharaman in the Union Budget for 2025 announced that 36 life-saving medicines will now be fully exempt from customs duty. This is a big relief for patients, particularly those suffering from cancer, as these critical medicines will now become more affordable. The government has also proposed a 5% concessional duty on some of these medicines, which will help reduce the cost of essential treatments. This step is aimed at making these life-saving medicines more accessible to the millions of patients who need them. Lastly, in Mumbai, Lilavati Hospital has launched a new cancer care institute. This institute will have a 300-bed facility dedicated to cancer treatment. The hospital has also partnered with the Mayo Clinic to create a nursing excellence program aiming to improve the quality of nursing care in India. The new cancer center will also offer personalized treatment plans based on each patient's needs, and it will also be using advanced technology including artificial intelligence to detect cancer early and improve the chances of successful treatment. Additionally, the hospital plans to run awareness campaigns to educate people about cancer, its risks, symptoms and prevention methods. These initiatives will help raise awareness and provide better healthcare for cancer patients in Mumbai and beyond. This news highlights some challenges in healthcare but also shows efforts being made to improve patient care and make treatments more affordable. This is all for today. Keep watching Fit Tak.